Hello, my name is Jahan Marcu. I received my PhD for studying the pharmacology of cannabinoid receptors, but today I'm going to talk to you about laws, standards, and politics regarding cannabis. Um, my email is marcuenterprises@gmail.com. For any questions related to this presentation, you can follow up with me there. So, while I do have a background in science, I've spent a number of years working on policy, regulatory affairs, and other issues, including being a court qualified expert witness on cannabinoids and synthetic drugs. I've published basic and clinical research and volunteered a lot of time with standards group to generate standards for the cannabis and hemp industry. I'm also co-founder of Marcu Arora, which provides industry consulting as well. I've traveled around the world to assess cannabis operations, look at regulations, and provide scientific lectures. So I'm going to hopefully today will be a nice blend of science melding with regulations and policies of cannabis. So today, I hope you walk away from this presentation, being able to summarize how cannabis laws, regulations, or the standards have changed over the last few decades. Be able to think critically about standards for cannabis operations and the products they produce. And I think this is important because as we compare cannabis and hemp in this presentation, in this country, we usually think about the FDA and product safety, and probably most of us throw away the product insert when we have a drug or another product that's FDA approved. We don't even read it. That's how lucky we are. But I think with cannabis and hemp operations, we have to take an extra step to make sure the product we're looking at is regulated properly. And to that nature, we'll end with talking about labeling, which is probably one of the biggest issues for products these days. So we'll describe, hopefully you'll be able to describe the major differences between cannabis, hemp, and illicit marijuana products. So a couple concepts to get us going today is just to think about how far the regulations have come from nothing to lab testing, product labeling, right? But they still have a long ways to go as new products are developed, as state programs expand, and we start to get into some tricky regulatory and scientific kerfuffles. Cannabis is what we call marijuana, but it's also hemp. Cannabis, scientifically, genetically, agriculturally is hemp, but legally it is not, because hemp is defined in the United States as cannabis with 0.3% THC or less. Hemp edibles, due to that fluctuating rule, right, 0.3% is a measure of weight, a hemp edible could have more THC in it than cannabis edibles in Colorado, which have maximum 10 milligrams of the product. So if you have a big enough hemp product, it could have a lot of THC in it. So we're going to, begin, I guess, at the beginning here with a timeline, starting in 8000 BC for some historical notes, milestones for cannabis, and on the bottom is sort of a timeline of scientific discovery. It's really only been since the 90s that our understanding of the pharmacology of cannabis has really, really expanded greatly. And this coincides actually with the passage of some of the first medical use cannabis regulations to be passed. I'll be talking about them in detail. But first, I want to, we all wonder, how did cannabis become illegal? Well, that wasn't really until the Controlled Substances Act. Until the 1970, a lot of jurisdictions allowed cannabis use, or it wasn't strictly illegal. However, in 1937, the first person to get arrested for selling cannabis without paying taxes on it, without the Tax Act of 1937, $10 at the time would probably have been close to $200 today. But he was the first person arrested when the Marijuana Tax Act was passed in 1937, which, people at the time, you could go into a doctor's office and for part of a penny, you could get a cannabis dose or treatment from a tincture or one of those old medicines. And that basically imposed a huge fine on it that made it not really useful to use because of the steep fees associated with it. And it fell out of use partially because of that, and then in the 1970s. Also going around about this time were medicinal liquor prescriptions. Printed here, what looks like on, could almost be like $100 bill, looks like an old note, but Here we see medicinal liquor prescriptions for whiskey as well as other alcohol. The one on the left says, 3 times daily. So I think when we think about cannabis and medical cannabis, you have to remember that even 100 years ago, these were workarounds when a substance was banned, such as alcohol. Fast forwarding to today, under the Controlled Substance Act, THC appears no less than 3 times in Schedule 1 as cannabis, where it is thought to have no medical qualities and a very high abuse potential. And then it also appears in Schedule 2, along with Vicodin, cocaine, amphetamines, and Adderall in a liquid preparation known as Syndros. It also appears in Schedule 3, similar category as ketamine, steroids, and things like testosterone, replacement therapy drugs, Marinol, pure THC, which was FDA approved in 1985. We also find other cannabinoids there, like purification of CBD as Epidiolex, and many hemp products that we'll discuss to the end could be considered to be descheduled because they do not appear in the scheduling category. So there's even, THC in a low percentage in the form of hemp isn't even on this list. So a bit of a spoiler alert for this next slide. Today, 34 states have legalized cannabis medicinally. At least a dozen states. We don't know what's going to happen from the next week before this comes out. There might be more states, but 12 have some sort of access program for marijuana laws, which allow low THC, high CBD products, hemp products, essentially. And cannabis is fully legal for all uses in 11 states, despite remaining illegal at the federal level. And so this has started off largely in the West Coast, and then over time, more and more East Coast states have adopted cannabis laws and regulations. And we'll go into some of those details. But as this map filled out over the last, really just this century, beginning towards the end of it, we see the map is really covered in green. So before that, though, in the 70s, there was a federal IND program. Where does the cannabis for research come from? Well, it comes from a farm in Mississippi. Today, though, there are more licenses out for federal production of cannabis for the use in research studies. But at the time, this was pretty novel. So they developed a cannabis variety based on confiscated samples from the 70s. And this program, as you can see on the left, started off as an outdoor operation. They've moved it indoor now. You can see it has a guard tower, and then there's a barbed wire fence around it. All of that to keep the cannabis plants from escaping. When this program started in the late 70s, patients were basically shipped canisters of pre-rolled cannabis. There's a dwindling amount of people. There's basically, I think there's 2 or 3 patients still receiving these canisters to this day. It was closed in 1992 to applications, but all of those patients were grandfathered in. The cannabis product looks very much like a cannabis product from the 70s. You can see in the left-hand corner a label, 300 cigarettes per can. Remember, these were shipped monthly to patients, so that's about 10 cannabis cigarettes a day, weighing a little less than a gram each, as you can see. And if you look carefully in the bottom left, you'll see that in this picture, it's a Pall Mall cigarette paper used to roll them. There are stems and seeds in these from time to time, depending on what variety you're using for research. Again, these are standardized products. And one of the reasons they put a little bit of stem and seed in there is because the cigarettes get stuck in the rolling machine, so it can't be too sticky. But since, starting in only fairly recently, about 20 years after the IND program, we actually started to see California pass the first medical cannabis laws, followed by Alaska, Oregon, and Washington. Maine followed, then Hawaii, Maryland, Vermont. We see this onward march, a lot of reform happening, again, just in a short period of time for medical cannabis laws. So despite all these changes in cannabis reform, evidence of medical use is prohibited in cases involving cannabis. So if you were a medical cannabis patient or a provider, you could not use as evidence in federal court that you were obeying a state law or a program. You'd be treated, again, as breaking federal law completely and wholly. And this continued for a long time until Steve McWilliams, who was a medical cannabis provider to the seriously ill, was arrested and charged with federal court. He was not allowed to use facts that the cannabis he was growing and distributing to the seriously ill patients was in fact part of a cannabis program. And unfortunately, he committed suicide while awaiting sentencing. And because the Steve McWilliams Truth in Trials Act was first introduced in 2005, but it actually wasn't until 2012 that it was passed, which provides this defense for the medical use of cannabis and prevents things from like the immediate seizure and sale of property. So part of the reasons that medical use was prohibited was that while California was passing its medical cannabis use regulations in the 90s, Congress was undermining these efforts and actually passed a resolution saying marijuana is a dangerous and addictive drug and should not be legalized for medical use. So basically, the adoptions of state laws captured the national media. This press coverage prompted Congress to take action, and they basically introduced this to penalize individuals participating in state reforms. So I think that this was sort of an interesting time. So as these laws continued to evolve despite Congress's attempts to undermine them, really, I think there was strong public support because Prop 215 was sort of the result of the AIDS epidemic. A lot of HIV/AIDS patients seemed to be benefiting from cannabis. Research was showing in clinical study that they were gaining weight and living longer. So So basically, Prop 215 is also known as the California Compassionate Use Act. And under this, cannabis cooperatives proliferated across California. State officials widely opposed the California Compassionate Use Act. And it wasn't really until Gonzalez versus Raich and other federal court cases that these laws were challenged. In 2003, SB 420 imposed duties on state and county health departments. And basically, the CCUA and MMPA established provisions that created this skeletal framework for more medical cannabis programs. And so, as they say, as so goes California, so goes the nation. But another thing that they passed in 2013, 2009 were the Cole and Ogden memos. These were really important. Under Trump, Jeff Sessions rescinded one of these memos. Basically, this was federal guidance for prosecutors considering marijuana investigations or charges in states where marijuana had been legalized. There's these state laws, there's all these ordinances and requirements to operate, but the feds can shut you down and arrest everyone at any time. And so there's a bit of a conflict there between state and federal law. So basically, the Ogden memo gave the U.S. attorneys guidance and clarification on how to enforce the Controlled Substances Act. So again, this basically set some sort of guidance that don't enforce federal laws where it's legal. And so these cannabis programs continue to evolve, and basically, there were 4 provisions that were established: criminal immunity for patients, immunity from licensing, punishment for physicians who recommend cannabis under state programs. There were established personal possession limits. It wasn't just a free-for-all, and you could have as much cannabis products or cannabis flowers as you wanted or grow as much as you wanted. There's also establishment of a caregiver system where an individual is permitted to cultivate and produce cannabis for qualified individuals. Despite these imperfections, this actually set the stage for tons of the medical reform efforts. So there are 6 core concepts for medical cannabis programs that have evolved and laid the foundation for many of the state programs we see today. If you look at the 30 or so programs, you might find some similarities, right? So there's personal possession. Many allow some form of at-home cultivation. Although many municipalities have banned this practice. Physicians may recommend or certify cannabis use for a patient. There is an affirmative defense from criminal prosecution for patients, caregivers, and physicians. And remember, this was really important because even if you were, say, a medical cannabis patient in full compliance with state law, you could still get into quite a bit of trouble at the federal level because you would not be able to use any of that information that I am following state law. It set up a patient caregiver relationship. There's a patient caregiver registry, and you may purchase medical and medical products tax free. One of the differences between being a patient and just an adult consumer or adult use programs, I think, is treating these products more and more like a medicine. And in 2012, 2013 were big years for adult use. Colorado and Washington State passed adult use cannabis laws. What is interesting about this is that there was absolutely zero support from elected officials for this, but the people who elected them demanded it, and they basically was only possible through a citizen ballot referendum process. So think about how amazing that is. People actually wanted to pass cannabis regulations for adult use despite not getting any support from their elected officials. Adult use policy is similar but a little bit different than medical cannabis. So one of its goals was to eliminate the illicit market, promote individual liberty, and define personal possession limits, generate state and local tax revenue, and redress the impacts of cannabis prohibition and enforcement by creating a safe and equitable cannabis industry. I think we were starting to see some of this in New York with the opening of like the Housing Works cannabis dispensary, for example. But I think one of the most important concepts we see all the time is that states legalizing cannabis, medical or state legalization, doesn't mean the absence on limits of cultivation, possession, or even how you process or handle the product or how you label it. So again, I think it's always important to remember that just because it's regulated doesn't mean you can have as much as you want. There's even limits on the amount of individual alcohol you can make a year as well. So we've talked a lot about adult use and medical cannabis regulations and that timeline and that rollout, seeing a number of states basically hinging on four concepts or four tenets and like six concepts to develop these programs. However, also paralleling this has been the rise of CBD, which again really took off in around 2007, 2008. And we saw just this meteoric rise where there are some case reports about CBD helping children, and then that eventually led to pharmaceutical companies pursuing the drug approval for Epidiolex, a purified CBD product. But during this time, especially in 2014 and 2018, we see the passage of the Farm Bill. And I apologize for the quality of this next picture, but I thought this was a great summary of what the Hemp Farm Bill did. It says how hemp and the Farm Bill may change life as you know it. Well, so imagine you've been in this space for 20 years and you've seen the early cannabis programs allowing collectives and cooperatives to form. You've seen the laws totally change from not having an affirmative defense to having an affirmative defense. You've seen more and more protections for the industry, abilities to pay taxes. And then along comes the Hemp Farm Bill, which says marijuana is going to sort of bifurcate now. And basically, what we had is that in 2014, it allowed the production of hemp as long as it was another 0.3% THC. 2018 people interpret that as starting to allow commercial sales of these products. And it expires in 2023. So it expires this year and it has to be renewed. We don't know what changes there will be, but basically it defined hemp as anything 0.3% by weight, THC or less. However, it doesn't come with the same requirements as medical cannabis and adult use. Require licensing, require registration of people who are using it. There's product and labeling and testing requirements, as not to mention tons of licensing issues as well. So when it comes to hemp products, one of the major differences is the variety of packaging compared to adult use and medical cannabis products. So with with adult use products, you'll probably never see psychedelic tinfoil packaging like this. This only would be a CBD product. And I think that some of this product, for example, has some labeling issues where the things don't really add up. You have a 2,500 milligram bear, that's what they call one dose. There's 2,000 milligrams of sugar. You account for the 0.3% of THC. That's 75 milligrams of THC. Where's the rest of it, right? Who knows what it might be? Maybe it's extract or what. So there are some testing and labeling issues. And the reason this is important is because most people have trouble interpreting food labels. They have trouble interpreting cannabis labels. Actually, they surveyed cannabis users or who identify as cannabis users, and they did not know what the universal symbol for cannabis meant. Now, each universe has its own symbol. Here are 7 universes, or California, Arkansas, and other states with their universal symbol. Hemp products are not required to have this label, but again, you could have comparable products with comparable amounts of THC in them. So again, we have many U.S. jurisdictions. Each state kind of has done its own symbol. So I know they use the term universal, but maybe it's because we live in a multiverse. And even the labeling requirements among cannabis products changes. Every state requires THC content and a manufacturer contact info. Most states require batch numbers and listing of health risks and production tracking, but it starts to drop off rapidly, where some don't even require you to list a food allergen warning. Nutrition panels are, I guess, about 60%. And anything like that, you can see that CBD amount for testing, listing mold testing, usage instructions, that's about half the states require that. So there is quite a bit of variety in the regulatory experiences with cannabis product labeling. Luckily, though, there is a solution to a bit of this mess, and that is something a group called ASTM is working on. It's an international standard, and this was just approved, but it's the International Intoxicating Cannabinoid Product Symbol. So regardless of whether it's hemp or cannabis, adult use, medical, if it contains intoxicating cannabinoids, this is one of the options, one of the things to look for as cannabis programs continue to evolve. But the Hemp Farm Bill created an issue because people started extracting cannabinoids, purified compounds off the plant, and processing them into other compounds, such as Delta 8. Again, this is a familiar territory where there's a conflict between federal law and state law, or even between 2 federal laws. But when the Hemp Farm Bill was passed, no one really knew what Delta 8 was. Delta 8 THC is an isomer of THC that is often derived from CBD. So you take CBD from hemp, you put it in some acid, and you can create new compounds. But Delta 8 is banned in many states and is a Schedule 1 drug, so it's completely legal. As an expert witness, I'm involved in discussions with 2 cases right now involving the content of products labeled as either hemp or Delta 8. And if we go by, again, the DEA, which we have Delta 8 specifically listed in their Orange Book, which is the guidance for what drugs are illegal and what's their scheduling status. So simultaneously, Delta 8 is a Schedule 1 drug if it's on the cannabis plant. But if it is hemp-derived, the same pharmacological drug, identical in every way, is considered not a Schedule 1. So it's both a Schedule 1 and not a Schedule 1 drug. Not a great place to hang out, in my opinion. So in response to many of these products and a lot of explosion of product diversity, colleagues and I and students set up a cannabis experience form. So this is the QR code. Feel free to scan it if you would like to report a cannabis experience. This is all anonymized user data, but if you have used cannabis and have had an unwanted effect, you can participate in science. We don't anticipate synthetic derived cannabinoids to go anywhere. We just think there should be probably more regulations and more education. It's a huge market, synthetic cannabinoids. So if you like this presentation, you could tune in to How to Launch an Industry. It's a podcast that I do with my colleagues and one of my business partners. And again, you can participate in Science Today by reporting your cannabis experiences. Unexpected effects is what we're interested in. So I'm happy to take any questions if you'd like to reach out to me about this presentation or topics discussed within it. But again, I just urge everyone to be cautious with unregulated products. Product safety is not a priority in the illicit market. We only really have one system in our country for tracking adverse events, and that's the FDA Adverse Event Reporting System, FAERS. And it's definitely I don't know if it's up for the task of tracking all these different cannabis products. So we've developed budsinfo.com, designed by researchers to make it easier to interface and collect such data. So check it out, help us continue its development. I definitely would love to see more data generated about Delta 10, THCO acetate, and other isomers of THC so we can figure out sort of the safety profile, the risk profile of all these different products. If this whirlwind tour was of interest to you, I recommend a couple of things. Studies by Kruger, Jameson, Mead, and O'Connor. These are great sources of information about modern cannabis programs from the peer-reviewed literature.